Well, in this week's Cardiology Countdown, we have an interesting study on pregnancy outcomes in Marfans syndrome. Also, a look at the prevalence and control of hypertension over the last decade in the United States, some sobering news, and a battle of the potential blockbusters, the new antiplatelets, which one works better for patients with high platelet reactivity despite clopidogrel. So first up is a very interesting series of patients with Marfan syndrome who undergo pregnancy. They studied 69 patients who had 199 pregnancies, and 170 of those came to live births, and looked at the outcomes in terms of acute complications, of aortic complications. Unfortunately, there were none. However, they did note that the growth of the aorta was faster during pregnancy, and outcomes were worse in patients who had prior pregnancies versus women with Marfans who did not. And so I think some sobering news that there are long-term consequences of pregnancy, although the acute outcomes are reasonable. Next up, we have a study that comes from the NHANES surveys looking at hypertension and the control therein, spanning a little over a decade. And so they looked at surveys 1999 to 2000, then all the way up to 2010, to see what percentage of patients were classified as having hypertension and how was the control. Now, interestingly, the prevalence was about 30% in both men and women, and that has been roughly stable, slightly lower over time. But the control had really sobering results, where only 40% of men and 56% of women met their blood pressure controls, and that did not really improve over the last 5 years. Slightly improved over the first half of that decade, but we remain with roughly half patients not having good blood pressure control. And so a reminder that here's a standard major risk factor with medications that are all generic largely, and yet we can't quite get good control of that risk factor. And the top pick this week is a very interesting study, a battle of two new drugs, a head-to-head study looking at platelet function of ticagrelor and prasugrel, the two more potent P2Y12 inhibitors, and studied specifically in patients who had high platelet reactivity despite clopidogrel, and so those clopidogrel-resistant patients. They had about 31% of a series of about 200 patients, and so 44 patients, and they randomized them and did a crossover study to getting the standard doses of ticagrelor and prasugrel. And interesting, ticagrelor had better results in terms of platelet function and inhibition. They used the Verify Now assay and got the PRUs down to about 40 or so with ticagrelor, actually 32, and it was more like 100 on prasugrel, and they did a crossover and confirmed those numbers. And so interestingly, in those clopidogrel-resistant patients, it appears that ticagrelor had better inhibition of platelet function. We don't, of course, know clinical outcomes in that situation, but I think very useful head-to-head information that we've not had previously. So for this week's Cardiology Countdown, I'm Chris Cannon.